Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Zia. I welcome all of you from Master of Medical Knowledge Hub for today's lecture of fluid balance in surgical patients. Fluid balance is a very important aspect in perioperative management of surgical patients. What are the objectives of today's lecture? We want to revise the fluid compartments of human body. What are the signs and symptoms of the fluid imbalances? How we can assess the fluid status of our patients? What interventions are available for fluid imbalances? And what common fluids we can prescribe in perioperative management of fluid imbalances? First of all, just revise your previous knowledge of fluid homeostasis of human body, that almost 70% of total body weight is comprised of body water. Total body water is divided into intracellular fluid and extracellular fluid compartments. Out of the 70% of total body weight of total body water, 40% of total body weight of body water is present in the intracellular compartment, while 20% of total body weight of body water is present in the extracellular fluid compartment. And this 20% is further subdivided into the interstitial fluid compartment and intravascular fluid compartment. In the proportion of 15% in the interstitial fluid compartment and approximately 5% in the intravascular fluid compartment. If we see this pie chart, we can notice the distribution of body water, that measure of the total body water, almost 65% is present in the intracellular fluid compartment, while 25% is interstitial fluid, and small amounts are present, almost 8% in the plasma, and 2% are the transcellular fluids. This slide is summarizing what we have discussed in the previous few slides. Just revise it, that total body water accounts for 60% of the total body weight. And in an average young adult female, it is almost 50%, that the fluid content in female is less than in the young adult male. The highest percentage of total body water is found in the newborns, with approximately 80% of their total body weight comprised of water. That's the reason, that's the clinical significance, that the neonates can have serious consequences of dehydration, as almost 80% of their body weight is comprised of water. This composition of water decreases with age to approximately 65% by the age of 1 year, and thereafter it fairly remains constant. What are the fluid compartment compositions? This table is summarizing the two ions in the fluid compartment. One is the cations, which are the positive ions, which the major cation is the sodium. Its concentration in the plasma is 140 millimole per liter. In the interstitial fluid, it is 146, while in the intracellular fluid, it is 12. So now we understand that sodium is the major extracellular cation, while if you see in the lower part of this table, the anions, the negative charged ions, the chloride is the major anion in the extracellular fluid compartment. While if you see the potassium, potassium is the major intracellular cation, as compared to very less concentration in the extracellular compartment. Thank you very much for today. Next time we'll meet in the next topic.